When we come into these places, your biggest fear is always finding somebody overdosed, you know what I mean?
Over the last 6 months, this has become a well-trodden path for Thistle staff.
You can certainly see that a lot of this is new, but this could easily be just 2 or 3 people that are doing this, you know, easily, because there's sometimes people having like 10 injections a day when they're using cocaine, etc., you know.
Twice a day in pairs, outreach workers pound the pavements, visiting areas including waste ground and supermarket car parks, which are known to be public injecting sites.
So they've put this fence up to stop people from being able to get further in. They've put the needle bin in. Now they've cleared this away, it's much more open than it used to be.
But there is evidence of drug use here.
Oh yeah.
Recent drug use.
Yeah, very. Yeah, so those spoons and stuff like that have probably only been there for potentially a few days.
They monitor hotspots and are looking for those willing to make the short walk to the UK's first drug consumption room.
And if that encourages one person to come up to the Thistle, then it's worth it.
In response to an outcry from the community in Carlton, some public injecting sites have been cleared by Glasgow City Council, but it's an ongoing battle.
This is all very overgrown, you can see which has all been kind of cut back. Yeah, job done in this area, but unfortunately all it's done is moved it 1 street over.
Why wouldn't they go to the Thistle?
People don't trust. It's different. People who've been injecting for years have got into the habits of how they inject, what the process is, and to then come into a service where they're injecting in front of a professional worker and stuff like that is alien. You know, it's a very, very, very strange thing for a lot of them. Difficult thing for a few of them to kind of overcome that barrier.
Inside the Thistle, those entering the injecting booths must follow strict rules. They cannot share drugs and can only bring what they intend to take. What made you think, oh, I'll come today?
Just like any other day. It's a good place.
This man, who we've named Adam, has become a regular. He started coming to the Thistle as soon as it opened, and he sometimes visits 2 or 3 times a day.
If this wasn't here, I'd be doing that. Carlton just have a hit for overdose. Well, they had a few hits.
And what is it that you're taking?
Cocaine.
Adam says he first tried heroin at 14. He now injects cocaine. He has overdosed 16 times. In June, more than 70% of those injecting under supervision at the Thistle took cocaine. Some mixed it with heroin.
There's been a few people overdosing here in front of me. Boom, they're on it straight away. Saved them. If they were outside, you take the ambulance here and they'd have been gone.
That must be quite frightening though, to see that.
I'm used to that. I've brought a lot of people back in Oxford. First time I overdosed, Oxford wasn't even out. People actually care. It's happened about accepted help, you know.
Would you accept help now?
Yeah.
The numbers injecting drugs at the Thistle have fluctuated since it opened. Last month, more people came to use the facility's additional services, which include wound care, a laundry and other health support. Staff have supervised more than 3,000 injections. There have been 39 medical emergencies.
We've all experienced them multiple times now, and yeah, you're just kind of hands-on. Everybody gets involved, and we've managed with just oxygen for a lot of them, which is great. We've not had to give naloxone to every person. We have a really kind of thorough harm reduction plan with somebody after they've overdosed. There's a crisis outreach service that we work with as well. We make sure that they've got a lot of support in place and understand the risks going forward of injecting after an overdose, but people will still come in and inject, and we just support them with that and have a chat at registration then the next time they come in to make them aware of the risks.
In April, a batch of so-called green heroin was in circulation. It was so potent, nurses dealt with 13 overdoses that month.
Through the years I've seen hundreds of overdoses, and these ones, man, were different, you know what I mean? So this is the importance of having a service like this. It's not for the here and now. Think about once we start seeing fentanyls and all that stuff out in the streets. We've not seen the worst yet, we've not seen the brunt yet.
The first week of July has also seen a spike, 5 medical emergencies in 7 days. That was the same amount seen across the entire month of May. This time, staff don't have a clear-cut explanation. The Thistle believe a drug-checking service would help identify what is in the street-bought substances brought into the facility. A licence for this proposal remains with the Home Office.
As you can see, there's people obviously been using fairly recently here. Needle on the wall.
But if you're living in that house...
Oh, you'd be disgruntled. There's no getting away from it, of course. 5 steps away from the needle bin, yeah. It's frustrating to know that, and obviously you're only 5 minutes away from the Thistle as well, that those people who left them there could have came to the Thistle. Yeah, that's frustrating as a worker, but we'll keep chipping away.
Drug-related litter is a standing issue on the agenda at these round tables held every 6 weeks. Residents in Carlton say safety is a constant concern.
We're under no illusions that there wasn't any kind of problem in this area, but absolutely nothing to this extent. And I've lived here all my life, and until this happened, I didn't see anyone standing injecting in front of me ever, and neither did my children. And now they're putting in sharps bins that are very little being used as far as we can see. And also, does that become the norm? Does that make this normalised, that you should have sharps bins in an area?
I do feel that frustration from the community. We've put significant investment in, we've got a specific action plan, we've got teams who are operating there on a daily basis now, doing daily patrols. Before the Thistle opened, all of the work that we did in terms of needle uplift were reactive. They were reactive to the reports that we were receiving. Now we're being proactive, and I think that's a good change in terms of that investment.
Residents, like Thistle staff, undertake their own daily patrols.
But they're just coming back the next day and doing it again, so the council workers have got to come back. And I've asked the question, how long can you sustain this? How long can you sustain council workers every day having to come out and keep lifting these needles? We're not saying close the place, we're not damning the place, but what we're saying is all of this money is going in to enable people to continuously self-harm. And where is prevention and where is recovery in that? So is this just going to be a cycle that we're going to have here?
I still bang into people when I'm doing outreach and I say, have you ever heard of the Thistle? No, it's been high profile since it opened. There's been obviously a lot of negative publicity around about it and stuff like that, which may have been having an impact on the number of people using the service as well.
Some people say you're encouraging drug use then.
You're encouraging safe drug use is what you're doing. And at the end of the day, the drug use is here, you know what I mean? It's not going away anytime soon. At the end of the day, we're never going to reach everybody. It'd be just naive to think that we're going to get every single injecting drug user to come into Thistle. That's never going to happen, you know. But if we can make a massive dent in the number, then it's all worth it.
It's early days for this pilot. For the next 2.5 years, what happens inside and outside the Thistle will remain under intense scrutiny. Sharon Frew, STV News, Glasgow.